Did you know that chronic diseases are responsible for more than 7 out of 10 deaths in the United States? That's already crazy, but did you know that too little or too much sleep can be associated with these chronic diseases? How could that be the case? Well, let's take a look at a paper that was published about a few days ago that's gone viral and actually talks about this. Let's break it down. What's up, everyone? My name is Henrik and welcome back to the channel. Today I'm breaking down an observational research study looking at how the length of sleep is related to the onset and accumulation of chronic diseases. Chronic like heart, brain, liver, kidney disease, and mental disease. This was published in October of 2022, which is a few days ago as of today, by Dr. Séverine Sabia and others from the University of Paris in Paris, France. As of today, this paper has over 40,000 views and has been reposted by many different media sources. And I'll throw some of those up here. But today I'm breaking it down on a deeper level, looking at the methods or the actual results from the paper, and how does the data compare to what was done in the past from other studies. Let's break it down. All right, so this is an observational study looking at sleep and the onset of chronic diseases. The data is taken from a larger British cohort comprised of civil servants, and this cohort was called Whitehall II. It was originally established in 1985, so this data has been collected repeatedly over the past 35 years. And it started with around 10,000 individuals aged between 35 and 55 years old. Every 4 to 5 years, these 10,000 people were asked several questions about their sleep and other questions. And this is actually a chart that shows how many people were successfully contacted per year. Most importantly, these people were specifically asked, how many hours of sleep do you have on average per week, per night? The response categories were less than 5 hours of sleep, 6 hours, 7 hours, 8 hours, and greater than 9 hours. So in this case, sleep was self-reported. Actually, in 2012, the researchers measured sleep using electronic wristbands over 9 days. So in 2012, that time point is pretty accurate, but otherwise self-reported sleep is a pretty significant limitation, and that's an important consideration here. For all subjects, except literally 10 patients, which is pretty good, the researchers had direct access to patient medical records. So if a patient got a chronic disease, the researchers could instantly know about it and note it in their time frame. The chronic diseases they specifically looked at are listed here, but beyond this, they also looked at the sleep relationship into death, so all of these diseases and death. Now, most notably, hypertension and obesity are not on here, and specifically that's because the researchers said they're considered to be risk factors for cardiovascular disease as opposed to a disease itself. Now, this is pretty contentious just in modern day medicine, but this type of methodology and not including it in this consideration of chronic disease has been supported and repeated in the literature in the past in these types of sleep research studies. Beyond sleep and the prevalence of chronic disease, they also measured demographics and other variables that can mess with the data. They looked at health behavior specifically, like smoking cigarettes, alcohol, how much you exercise, fruit and vegetable consumption, and if you're on like sleep medication or have a prior sleep disease or something like that. So they could adjust for these variables whenever doing data analysis, so they could specifically isolate sleep length to prevalence of chronic disease. So in this study, they looked at your age, your average sleep length per night, and your onset of any chronic disease, and any onset of multimorbidity, or the onset of 2 or more chronic diseases. This is a word I'm going to use pretty frequently. Now, interestingly, when it comes to the data analysis, if you're around the age of 50, plus or minus 5 years, and that data survey came in, so you report a sleep duration, like less than 5 hours a night. If you reported that at that time point, that was the number that was used, 5 hours per night. It was not an accumulation or average of your reported sleep over the past 25 years, but rather at that time point, in this case, 50, 60, or 70. Now, I guess the assumption with this method is that your sleep shouldn't change significantly over an extended period of time. You know, if you on average, sleep 7 hours per night, you're probably gonna be doing that over your entire lifetime. But it's important to note that it definitely can and fluctuate, especially around different life events when it comes to work, school, and especially stressful, maybe family life events. Let's say the data survey comes in and you had a family member who recently passed away, you're probably sleeping a lot less. And so you'd report that, even though that doesn't reflect how you typically sleep. And so maybe that can skew the data, and that's definitely a significant limitation of the research, something to take into consideration. Additionally, when it came to data analysis, they looked at these different transitions in this cool little chart. So like how many different people went through transition A, B, C, D, E, and what was your sleep at those time points, and how old are you, age 50, 60, or 70. In my video today, I'm going to focus on transitions A and C because those are the most impactful results. The paper does talk about the others, but they're not well reported on. They're not the main focus of what we're looking at, so only focusing on A and C. Let's get into it. Okay, so looking at this first chart at age 50, this is how many people slept for different lengths of time. I just think this was generally interesting. Can't really draw too many conclusions from this. I would have expected less people in that less than 5 hours, and I don't really know too many people that do that on average. Same thing with the greater than 9 hours. I would have expected a little bit more, but you'll notice that that's actually a pretty significant limitation. It's harder to draw conclusions whenever you have lower sample sizes. But looking at the main data analysis, in this paper, the researchers analyzed the data in 3 different ways using 3 different models. The first model, they adjusted for 0 outside variables. The second model, they adjusted for demographics. And in the third model, they adjusted for demographics and health behaviors and really everything else. And health behaviors, remember, was smoking cigarettes, was drinking alcohol, exercise, eating fruits and vegetables, sleeping medication, everything like that. And so using model 3 is really the best way to look at the data. You're adjusting for everything, and you're isolating sleep duration to chronic disease. You're not isolating sleep and alcohol usage to chronic disease or sleeping medication. It's sleep, chronic disease. So that's the data we're going to look at. Okay, so first looking at multimorbidity. First we can look at the age 50 table, and looking at our p-values, we can see that if it's less than 5 hours of sleep, p is less than 0.01. And the hazard ratio, or HR, is a 1.3 for model 3. This means that people who sleep at age 50 years old, if you sleep less than 5 hours a night, you are 30% higher risk for developing multimorbidity. And that is significantly different because the p is less than 0.05. Now, if you look at greater than 9 hours of sleep, it's not significantly different. So although it says 1.39, that's not really significantly different from 1.00. So you can't say that greater than 9 hours of sleep is associated with multimorbidity. You can only say that less than 5 hours of sleep a night is associated with multimorbidity. But if you notice at ages 60 and 70, that greater than 9 hours of sleep is associated with multimorbidity, just not at 50 years old. Looking at the next set of data, this chart right here shows the literal measured sleep data using the electronic sleep bracelets in 2012. So it's looking at 1 year. And as we can see here, the adjusted model 3 that adjusts for all health behaviors and demographics, showed a higher risk of multimorbidity for people who slept less than 5 hours of night, but not really for greater than 9 hours. This is for age 50. The black line is where we expect the data to be, and the dotted lines represent a 95% confidence interval, which is a statistical term that says, we are 95% confidence that the actual data predicted by the model is somewhere between those dotted lines. So as you can see, the hazard ratio increases as you get towards less than 5 hours of sleep, and it stays around 1 for greater than 9 hours of sleep. So increased risk of chronic disease with less sleep. So these several charts were looking at developing 2+ diseases, multimorbidity. But what about the risk? What is the risk associated with developing just 1? So this is specifically referring back to transition A in our chart. And so when looking at the adjusted model, adjusting for demographics and health factors, we can easily see how people were at a significantly higher risk for developing that first disease for less than 5 hours a night at age 50, but not for any of the other sleep ranges. So sleeping less than 5 hours a night, associated with disease. Sleeping greater than 9 hours, not. Basic outcomes. Okay, so to briefly summarize, if you sleep less than 5 hours a night on average, you could be at significantly higher risk for developing at least 1 disease and many more after that at age 50, 60, and 70. If you sleep more than 9 hours, there's really no age difference. There's no difference at age 50 in regards to multimorbidity, but there is for 60 and at age 70. Now, there was no significant data for individuals sleeping 5 to 6 hours, 6 to 7, 7 to 8 hours, but some of the data might suggest that there is some sort of directional relationship, meaning if you get like 5 hours of sleep, that's still better than 4.5, but it's still worse than 8. And so maybe meaning the less sleep you get, or maybe the more sleep you get, could still be at higher risk. So you still want to stick to an average. Still better than the lowest point, but it's still not the best. Today's research is new, it's published 4 days ago, but it's heavily supported by many other larger studies in the past, actually. The study shown here from 2019 showed that there was a higher risk of multimorbidity with sleeping less than 6 hours a night. This study from 2020 showed that there's a higher risk of multimorbidity with sleeping less than 6 and greater than 8 hours per night. So not 9, as today's study showed, but this one showed greater than 8. This study from 2017 showed that there's a higher risk of multimorbidity with less sleep, but only for women, not for men, which is interesting. This study from 2018 showed there's a higher risk of onset of first chronic disease with both long and short sleep, less than 5 greater than 9, and higher risk of multimorbidity, but only for less than 5 hours a night. So this research is heavily supported, and not only in chronic disease, but for other states as well. Almost a year ago, I actually made another video on sleep, but this time related to cognition. And that research showed that sleeping much less and much more than around 7.5 hours of sleep a night leads to worse short-term memory and reasoning. It's associated with it, doesn't lead to it, it's associated. I definitely recommend you go watch that, but it truly supports that sleeping an average amount of sleep at night is better for your health in more ways than one than sleeping less than 6 and greater than 9 hours a night. But why is the research discussed today the most popular one, if it's seemingly been done in the past? As of today, it was published 4 days ago, and yet it has 40,000 views. It certainly wasn't the first paper published, not even the largest sample size, not even close. It didn't even look at data over the longest period of time, so what's special about it? Well, one factor is that it was published in a much more impactful journal. PLoS Medicine is a much more read journal by a lot more people than others. It has a higher H index, and it could have gone to a lot more readers. But that shouldn't account for everything. It shouldn't account for this significant difference. Beyond that, in the study design and the method, it had the opportunity to look at multiple time points, not only at one time point, like age 50, but also ages 60 and 70, and see how that changes. Additionally, they didn't only use self-reported. Remember, in 2012, they used actually measured data using electronic bracelets from watches, at least at that time point. So that was also novel. Finally, I believe that it had the strongest models, mainly because they measured so many other confounding variables, like whether you take sleep medicine, smoking, alcohol, exercise, whatever. You're able to account for that. You're able to develop a stronger relationship between sleep duration and chronic disease, which I think is the most important thing. So I think this is pretty interesting, and it can give some insight into what about sleep is important and how can it be associated with seemingly unrelated diseases. Like, how could sleep be associated with stroke or chronic kidney disease? I guess it has to be related in some way, but how? Who knows? Maybe sleep quality, like the length of REM sleep, and maybe even blue light right before you go to sleep can play a role in the presentation of these diseases, but I'm just really curious to see future research in this area. All right, why is this important to you? I'm sure many of you are not 50 years older or more, so why should you care? Well, most of these chronic diseases that I listed earlier require buildup. If you are diagnosed with heart failure at age 50 or 60, it's probably not because of something that only happened at age 50 or 60, but could have been caused by something in your 20s, 30s, or 40s. I think a great example is smoking cigarettes. The relationships between smoking and cardiovascular disease is very obvious and well reported. But if you start smoking in your 20s, you're probably not going to have any problems in your 20s and maybe not even in your early 30s. But the real problems really start to happen later on. And even if you quit later on, you still did some irreversible harm. What you do when you're younger still matters. And so maybe getting more sleep when you're younger still matters. So in short, it's important to develop those important habits earlier on to live healthier lives in the future. If you get good lengthened sleep, like 7 to 8 hours a night, you might not be at higher risk of multimorbidity and have a higher risk of first onset of a chronic disease. This definitely does not mean you will never get a disease like this, but rather you're not at a higher risk of getting it. There's this medical concept, prevention is better than cure. You'll probably hear this all the time in different areas, but it basically means it's much better to prevent the disease from occurring rather than having to treat it once it's there. It's always much harder to treat something once it's there. There are cures for things. There's always side effects associated with them. There really aren't too many perfect cures that I know of, but it's always better to prevent something rather than after it's there. And who knows, maybe sleeping adequately, not too much or not too little, can help with prevention. Maybe you learn something. But now I will seriously note that sleep is not at all meant to replace any actual medical care and any other healthier life habits. And this is definitely not any medical advice. This is just my objective review. And maybe a more technical perspective on what this research study is trying to say, and maybe to comment on what other news sources and the level of analysis they go into, as opposed to any opinion that I have on this topic. It's literally what this paper is saying. But regardless, I hope you all have learned something new. And if you did, you can click that like button and subscribe. But thanks for watching and have a good one.